lymphatic vessels just pump a little bit faster to carry a little bit more fluid out of the system. And we can measure how much better they're working by measuring the fluid accumulation in the tissues with bioimpedance spectroscopy, even if it's a very, very small amount. Okay. The key message so far is prepare the tissues. Do your breathing, okay? Empty out these places first before you expect the fluids to leave the arms or the extremities. Okay, empty buckets, number one. And then we can consider all the traditional treatments, which is your manual lymphatic drainage, your simple effleurage. And when we think about it, look at that bottom picture. Here's the most important one of all. Every time, just move your hand over your arm right now. Every time your hand's moving over your arm, this is what you're doing. When it moves over, it depresses the tissue. Okay? And every time it does that, what happens is it helps load the lymphatic system and takes the fluid away. And do you know what? A lot of the stuff is showing that it doesn't matter what you do, as long as you do something, it helps move the fluid along. Whether it's the complicated technique here that you see from Del.4, or whether it's a more simplified lymphatic effleurage or drainage technique done by a partner or a carer. The most important thing seems to be variation in tissue pressure, which can help load the lymphatic system and get the system thereby to start working and taking away the fluids like you see in that bottom diagram, just by changing the pressure. And that's what you're doing when you're doing this sort of activity as well. You're changing tissue pressure. We've done some clinical trials and used lots of measurement techniques to see what's happening when we do home-based massage, whether it's machine-based massage or hand-based massage and the like. And like I've shown many people before in these trials, to work out what works well, we use pigs. Can you imagine massaged pigs? You know, I mean, I must admit, I still eat a bit of bacon every now and then, but we had lovely little pigs. They're about 10 kilos, and we come in and they got massaged for a year. How good is that? A whole year. But you know, they knew who was good at massage and knew who wasn't good at massage within a few months. They liked some of our therapists and they hated other of our therapists. They would just run to the other end of the room when some of them come in. And it was so embarrassing. They knew more than we knew. But it correlated with some of the measurements. But after every massage, the pigs absolutely loved it. They're happy little lads and lasses. And a pig, after 3 months, 100 kilos. Big. All right. Now, the next thing, after we've done our preparation, is going back to the more traditional treatments, garments and bandaging. You've got to make sure you've got the right pressure, the right gradient, and no tourniquet effect in your garments. So, you know, please think about that. We can measure all those effects. We can measure all those changes if we wanted to. But just remember, the pressure that's exerted by a garment will work better if you're doing a little bit of mild exercise underneath it. You get a much better result. So when your garment's on, just do a little bit of exercise and a little bit of activity and it'll get a better outcome. You can see here what the pressure's doing. The pressure's just reducing the outflow from the blood vessels and helping the flow along your lymphatic vessels as you have your garment on. Now, here is the next most important point, and this is why most people don't get a good result out of garments. And we're doing a trial on it at the moment. We haven't quite finished it just yet. The effects of a good garment or a good bandage are lost, number one, when someone removes it too early prior to going to bed. You don't have to put your hand up, but think about it. How early do you take off your garment before you go to bed? If it's more than an hour or more than even 30 minutes, you may have lost the effect of that garment all day. That's been on helping you all day. You took it off when you went home because you thought, oh, I've got to get it off. And you've left it off until you've gone to bed. You've lost the positive effect of it. So please think, if you can, leave your garment on until you actually go to bed. Before you take your garment off, or before you take it off, do your arm exercise. Clear out this area first so the fluid is not going to come straight back into the lymphatic system again. Then, once you've cleared off this, take off your garment by all means and leave it off overnight. But don't take it off too early. And the other thing is, don't wait too long before you get it on in the mornings, because otherwise you've lost the effect of being horizontal on a bed. So when you're horizontal on a bed, you're not having the fluid accumulating in your legs, okay? So what you've got to do is get your garment on pretty soon after you've got up. Otherwise, you're all of a sudden getting your dependent position and the fluid's accumulating in your legs. So get your garments on early, leave them on for as long as you can before you go to bed. Simple thing, and it makes a big difference. It's up to about 10% difference in terms of volume. Just leaving them off for 30 minutes, taking them off 30 minutes to an hour before you go to bed, rather than just leaving them on that little bit longer. Absolute key point. We'll present some evidence for that next time, a bit more evidence. I've got 3 more minutes, and my young friend, who might still be a friend or might not, is going to speak after me. So I'm... Oh, we're having a break. Ooh, good. Compression pumps. Compression pumps, I don't know how much you use them here, but in the States they're certainly usable, used a lot, and that may be beneficial for you or not. Don't rush in and buy all these newfangled things. Some of these things here, they happen to work fairly well. We've done clinical trials on them. Other people have done clinical trials on things, but try before you buy. Don't get talked into something on the basis of, you know, not much information, not much confidence. Try before you buy it. Rent it, borrow it before you buy it. And if it's for you, go for it. And, you know, one of our big philosophies with our patient group is it doesn't matter very much what you do as long as it's got some sort of positive impact on you, as long as it's helping what your problem is that's been measured to be shown to be your problem. And your problem might be a tough, hard limb. Your problem might be some extra fluid in your fingers. Your problem might be some extra fluid here in this middle thigh area. If we can help that, if we can stop it, if we can reverse it, we've made a big win. Even if it doesn't get any worse from today, you've made a big win, because most lymphodemas will progress. If we can stop it, you've got to be super happy. That's great. And all the things I talked about earlier are about measuring how that lymphedema is going. Measuring the fluids, measuring the fibre, measuring how well the lymphatic system's draining, and measuring the consequences of that. Some of the other new treatments, and I know Helena was talking about that earlier, kinesiotaping. It's great in a hot environment like in Australia, where you don't have to wear a garment. You can have kinesiotaping, which can replace that quite well. You exercise again, activity classes, get out there and do it at your level. Aquatherapy, like Helena was saying, you can't beat this. There's a lot of evidence for that at the moment. But the most important things are these in my second last slide. Know your risks, whatever they are. Identify them. Make sure the reason why your limb is swollen is lymphedema. There may be something else going on. There's some other reason why it's swollen. You might have high blood pressure. It might be your medication, but it might be systemic. There might be a DVT. Talk to your GP, talk to your specialist about all those sort of things. Make sure you or your therapist are measuring your limb accurately. Make sure you've prepared the lymphatic system for receiving and carrying the additional fluid, okay? I mean, even in Australia, you can't hop into a car, start the engine and roar off. You've got to let the engine warm up, okay? And with the lymphatic system, you've got to get it prepared. You've got to get it loaded, get it functioning slowly, and then get it working faster and more effectively. We can no longer afford just to look at a person with a swollen limb and just do manual lymphatic drainage or just do laser therapy. We've got to think carefully about what's the right treatment for that individual by making measurements, by collecting information. We've got to target the treatment and we've got to sequence the treatment to get the best outcome for you, and we know we can actually do that. Some of that will be traditional treatments like bandages, massage, compression garments, and some of it will be new treatments, different things, kinesiotaping, aquatherapy, electrical stimulation, new stuff. Look at the old, consider the old, but look at the new. We can't continually live in the past in terms of our treatments for lymphedema. We must move forward. But the most important point really is measure the effect yourself or make sure your therapist is doing it. So they're giving you the treatment outcome that you want, okay? And it might be just that the limb feels better. It might be the size. It might be how hard it is. Whatever you're looking for, you make sure your therapist is measuring that, and you make sure that you're giving them the right information to allow them to do that. This is my son. Ivona knows my son when he was very young. Please get your therapist to publish, because otherwise I'm going to keep on doing experiments on my son at home and all sorts of other places. You see, this is a whole body compression. I just wanted to see what happens when you put whole body compression on him. He left home eventually, so it worked. We got him out of the house. All right, so does anyone have any questions right now? Yes.
We actually prepared some questions. Is that okay?
Yes, that's perfect.
Do you want to take them or should I continue? Yeah, okay. Quick ones.
Do we want lights on? The light man up the back. Oh, that's pretty light. Hi.
From SEF, the board of
She's the board.
Oh, lovely.
Yeah. She's in charge of children and youngsters.
Wonderful.
Yeah, nice to meet you.
Cool.
Thank you
That's
for
where
this
you
speech.
And by the way, before I forget, I've bought some books from our clinic. Books on treatment, recognition and management of primary lymphedema, secondary arm lymphedema, secondary leg lymphedema, venous edema, lipedema, and breast edema. And if anyone would like a copy of one of those, I have to charge you for them. I think they're 100 Swiss crowns. No, where am I? Which country? Sweden. Yes, they're 100 SEK, but I've only got one example of each, and we can post them to you quite quickly for that price if you want one of those books. But I'll have to go up to my room and get them because I forgot them having a look at. So now the questions.
Yes, the first question. Is there much research done showing results of acupuncture in treating of lymphedema?
No.
Can we find that?
No, there's not much. There is a very, very good paper, however, on... I used to live in China, so I'm very much into Eastern techniques and Eastern philosophies. And there's some very good evidence to show that the ancient meridians are pathways of least resistance in the tissue from bioimpedance point of view. And therefore they're pathways where fluid is going to flow easily. But there's no good evidence out there for it. There's one small danger of acupuncture, and that is the risk of infection. But if you have an acupuncturist who's cleaning your skin and the needles are all clean, it's minimal risk. And it seems in some patients who are from the Eastern, our Asian patients we have at home, we have lots of them, they seem to be quite happy with that sort of thing and seem to report really good outcomes. But no clinical trial work has been done on it. But something's going on there, and there's some very good studies in different areas. Good question. Who asked that one? That's brilliant. Like that. I'd give you a prize if I had some.
And what is the latest advice about needle punctures and blood pressure
Ah.
on affected limbs?
That's a very good one again, because there was some studies quite a few years ago that asked patients to report on what they thought was the reason for their lymphedema developing. And some patients reported that it was an air flight, or was blood pressure measurement, or a needle or something. And in a way, that's very it's not got good evidence behind it. And there's nothing there that shows that transiently blowing up your cuff to 180 millimeters for a half a minute is going to make much difference. But on the other side of the coin, some work, I think it was Peter, wasn't it, showed that you can occlude lymphatic flow by putting it at about 60 millimeters of mercury. So if you had someone who was incompetent and had the pressure cuff up for a long time, it might result in some increased fluid accumulation in the spaces between your cells in your forearm, but then it should clear again. So no strong evidence for it, but you generally try and use common sense and avoid the arm at risk or the affected arm, but there's no evidence that it's going to actually